Hi class, for this lecture we are going to look at stress and the effects that it has on our bodies, our minds, and our emotions. So when it comes to looking at stress and the way that we know that stress is it's a reaction to something in our life, right? Something that is, no pun intended, but something that is stressful or something that causes us duress or negativity, right? We associate that as being stress, right? And really what it is, it's our perception of those things that we consider stressful or what causes stress in our life. Because as individuals, we all experience stress in one form or another, right? But the way that we react to it is a little bit different. So say that somebody say that maybe you're a survivor of a mass shooting or something like an environmental disaster. You know, they have done studies with students after these and with individuals in general, and you know, they see that the way people cope with those stressful kind of traumatic events, that, you know, the reactions to that vary. Some people can be, you know, really stressed out to the point that they get those mental disorders and get more into those, you know, not being able to function normally. And then you have some people that, you know, handle it a lot better and they can blow it off. And then you know, when it comes to things that stress us out, they're just we have different reactions to them, and you know, they're just different types of things that stress us out. There's a lot of things that stress us out, right? That seems to be a big part of just being alive and kind of the nature of our society. Alright, so what is stress? We define stress as the internal, psychological, or physiological response to a stressor. So what is a stressor? A stressor is anything external, any external stimuli, event, situation that puts such a physical or psychological demand on us that it inhibits us in some way, right? So we know that when you know, we have stress that are related to mental disorders. So we have the most common acute stress disorder, adjustment disorder, and then post-traumatic stress disorder. In addition to that, we also know that you know, stress really puts demands on us physically, and so that can cause a lot of illnesses that come up. You know, things like headaches, migraines, high blood pressure, you know, heart disease, heart attack. There are kind of studies that have shown the correlation between heart disease and the amount of, you know, stress in somebody's life there. So let me discuss these disorders there for a minute. So acute stress disorder is it's a milder form of PTSD, and not milder as in those symptoms are more mild. It's milder as far as the duration goes. So it's kind of like when you first experience it, you have acute stress disorder, but then like with, you know, how we define something going into an actual mental disorder category has to do with that duration and the you know, and the effect that it has on you. So you know, once you start having those characteristics and you know, you can't get rid of them, you can't cope with them on your own, then, you know, you kind of add to the stress of that, and then it you know, turns into post-traumatic stress disorder. So really with acute stress disorder, we say it's when you have these symptoms for a month, and then when you have them for more than a month, then we say it's post-traumatic stress disorder. And then we also have adjustment disorders, and that's really just once again, it's about coping distressors in life, and you know, someone with that disorder, they just have a hard time with doing that. We can also see too with that how some of these mental disorders are comorbid, which means that there's more than one occurring at a time. Somebody with adjustment disorder may have something like obsessive compulsive disorder too, maybe depression. You know, they kind of work in tangent like that sometimes. Alright, so when it comes to our brains and stress, we know that there are specific parts of the brain and then just specific hormones that play a role in that. So really, in many ways, as I said, stress is a reaction to something. And we could say, we could be a little Freudian and say that stress is a defense mechanism because it's a way for us to survive, right? And it makes more sense when we go, into our far back into our prehistoric past where, life was a lot more chaotic and stressful for our ancestors. That stress, that was a reaction to something. That was what kept them alive, allowed them to survive. And so that all relates to our brain because what's some of the most primitive parts of our brain are amygdala. We know that has to do with memory. It has to do with emotional regulation. And so because of that emotional regulation, because our amygdala is our flight or fight instinct there, which is that anger and fear instinct we have, all of that relates to the way that we perceive and respond to stress. So when it comes to hormones, we know that cortisol, epinephrine are two of the main hormones that are released in response to stress. And then we also have the hypothalamic pituitary adrenal axis, and a fancy word for saying that little connection there from the hypothalamus to the pituitary gland, and that there's just a little axis there, and it's kind of like neurotransmitters. Those hormones are lighting up, kind of that little interplay there, and so we know that is something that we do in a reaction to stress. And then we know that our sympathetic nervous system plays a role in how we respond to stress, and that's blood pressure, heart rate. We can also throw in constricting the blood vessels there. So once again, we see how all of that physically affects us. Alright, so when it comes to explaining stress, we of course, when we look at mental disorders and even just look at behavior in general, be it normal or abnormal, in psychology we like to take a holistic approach. So we take things from what we call a multi-path model, and basically what that means is we're looking at that interplay of how all these different factors play a role in shaping our thoughts and our actions and just our behaviors in general there. And so what we know is that, once again, be it normal or abnormal behaviors, we know that we are influenced by biology. We know that there's the psychological, mental aspect of it. We know that there are social factors involved in our behaviors, and we also know that there are socio-cultural factors involved, because that socio-cultural, they kind of work in tangent together, but then at the same time they're kind of on separate tiers there. So we know that it's always going to be an interplay of these four main categories. Something within each of these is always going to play a role in our behaviors. And like I said, it doesn't matter if we're looking at normal behaviors or abnormal behaviors. We always see these four categories working together in some way. So we know that, in some ways, the way that we behave, it's very much biological. It's evolutionary psychology, right? Because it is genetics. We know that there's a lot of stuff that just comes down to, kind of our psyche, just that the consciousness, that thing that makes us the individual and makes up all those characteristics and traits that we have, that psychological component of who we are as human beings. And then once again, the types of environments we grow up in, the type of relationships and networks that we form in life, those are going to play a role in how we think, behave, and feel. And then also, we got to break that social side down even more, because then we really start categorizing it, and we see things like gender, racial, ethnic, religious types of differences there. And what we know is that the more stressful an environment seems to, poverty, prejudice, racism, they all seem to play a role in that. So more stress. In fact, they have done studies and they're seeing that there are more kids in inner cities that are developing PTSD at very young ages, and it's just because of those factors and because of things like the rampant drug use and kind of gang violence. You know, these kids are living in these very, very stressful environments, and so, you know, psychologists are trying to work with those communities and find out ways, you know, to help those kids deal with stress more, and then of course in turn, you know, get social changes as well there. So when it comes for some of the ways that we cope with stress in psychology, there are specific types of therapies, and you know, once again, when it comes to treatment and therapies, they're usually they're a process, just like anything in life. You know, there's never a quick fix to anything in life. You know, life is a learning and growing process, and we always have to continue to work on ourselves. And you know, stress plays a big role in that, because once again, our perception of how our lives go really relates back to the amount of negativity that we have in it. And you know, I'm not Susie Sunshine. I know life is not all unicorns and rainbows, but it's about taking that holistic approach. It's kind of positive psychology. You know that there are good things that happen in life. You know that there are bad things that happen in life. And when you can learn to embrace both of those, because it really does come down to your reaction. The way you react is what makes that bad or good. You know, we put those labels on those things and those things that happen in our life. I was going to say people, but that's another subject, right, guys? So, but you know, the way we perceive things in our life, and since we put that out there, you know, we then can change that, right? And so, positive psychology is just learning to identify what stresses you out in your life, and then learning how to, you know, manage that stress when it comes up in your life, so that, you know, we can reach those levels of optimal happiness and well-being and be those fully functioning individuals like Maslow and Carl Rogers specifically talk about, right? So biofeedback training, that's a pretty common type of therapy, and pretty much what biofeedback training is, there are different ways you can do it. I mean, there are ways they do it where they kind of put these caps on you with little wires coming off, and they note your brain patterns, and then there are ways to where you can just kind of like meditative type ways that you can do biofeedback, to where you just kind of ask yourself stuff, and you just kind of, you know, feel in your body kind of what's going on, and then of course there's a little operant conditioning, because you kind of have a new reward system that you get with that. I mean, the more positive feedback you get, then, you know, the more you know, you increase those good hormones and neurotransmitters in your brain, right? And then, like I said, you know, stress, in a way, it's a defense mechanism. It's something that helps us survive. So it's kind of a regulatory thing. In many ways, we need a little bit of stress in our life. But, you know, once again, we don't need it to be so overwhelming that we're not able to function properly, because what happens then? We don't, you know, rise up that path of self-actualization, right? And that's okay too. We all get stuck and fall down that path at times in life. And, you know, once again, that's the good thing about being human and being alive, is that we can always learn and grow, and we can always relearn there. And then we have a prolonged exposure therapy, and sometimes they do this with a lot of virtual reality. So, you know, they kind of, you know, show you the imagery, they put you in that real life situation, they put you in that, you know, so say like with the veterans returning from the wars who have PTSD, they do prolonged exposure therapy, and so they get in a virtual simulation of, you know, acting out those war components that cause them stress, and then as they're doing that, they kind of teach them ways on how to deal with that. I don't specifically know how to do it, but I know that that's kind of the gist of it there. And then of course there are things like meditation or mindfulness practices is what we call them in psychology. And so relaxation training, progressive muscle relaxations, they're all just you know, little therapeutic kind of practices that you can do that help our bodies to relax. When it comes to stress, we beyond those effects it has on our nervous system and on our brain and on, our heart and stuff, we also know that we tend to hold stress in our muscles, right? Think about when you get stressed out, what happens? Your body tenses up, your muscles tense up. And so in things like relaxation training, that's what you're working on. You're working on relaxing your muscles, allowing your muscles to open so that you're not holding that stress. And then, once again, it's kind of a way to teach yourself on how to deal with stress when it starts coming up. And they're actually really good exercises, guys. I've got one at the end of this, and I put it in the weekly overview for this week, too. So I would definitely recommend trying those. And then we also have things like trauma-focused cognitive behavioral therapy. And pretty much it's kind of like that prolonged exposure type therapy. It's about, identifying what it is that has caused stress, that traumatic thing that happened, and then you kind of change the way the person thinks and feels and then reacts to that, because that's all what cognitive behavioral therapy is about. It's about identifying the negative things, negative thoughts and feelings and reactions that you have in life, and changing those into something that's more serving to you. Alright, so when it comes to stress, don't read the top of that, guys, sorry. So, this is I forgot to take this off. But so, when it comes to stress, and we do this lecture in class, I always, give the students the opportunity to think about the things that, think about the way that stress affects us. And to think about the different ways that we cope with that stress in our life. I thought I had it. It should have come up, but it didn't. So, alright, so what kind of things stress us out? Commonly, jobs, work, school, money, traffic, other people. Those seem to be some of the most common causes of stress that us students note. And then when it comes to coping mechanism, the three things that students always point out, which I always kind of get a little mused over, is drinking, drugs, sex, and then actually we can add a fourth one, smoking cigarettes. Those always seem to be the top four answers. And the reason it always makes me laugh is because it's a way to show too that maybe sometimes the way we go about coping with stress isn't the most positive and productive ways to go about handling it. And that's just another, example of how we react to stress differently. Sometimes sometimes our ability to handle stress and the way that we go about handling it can make us more stressful. Obsessive compulsive disorder, we tend to think that they do that, excuse me, let me start over. So with the obsessive compulsive disorder, whatever that little ritual is that individual has to do, it is a response to stress, but it's not, it's the way that they're trying to cope with that stress, that they do their little particular ritual behavior thing that they do, right? And then sometimes it can get to the point though to where in doing that they're not relieving stress, they're causing more stress. So like extreme cases of OCD, it would be, say, somebody who has to always wash their hands, right? But they get to the point to where they're scrubbing their hands raw. I mean, they're down to the bone and their fingers and palms are bleeding, but they can't stop. They're still, doing that behavior. So just my point is that sometimes, even the things we use to cope with stress can end up adding more stress in our life. And, it really comes down to just, once again, individuals. It's up to us to identify those things that stress us out in life, figure out what works best for us and changing that. And then, a lot of times too, guys, I think this is the hardest thing for us to remember as human beings, because we are social creatures. We do care about each other and we want to help build up and strengthen each other. And in the end, we can only change ourselves. You know, we can't change anybody else. We can only change the way that we react to something and the way that we react to others. And all I could say from my own personal experience is that, you know, that's a good that's a good way to live life. And you do stress yourself out a lot, or you don't get as stressed out, I should say, you know, when you just try to, you know, do the best that you can, and then, you know, you just got to do the best that you can and just send out that positive energy to others and hope that, you know, they move up along their path of self-actualization. So when it comes to stressors, as we know, those things that cause us stress in our life. In Buddhism, there is this idea that is called Shimpa, and basically Shimpa, it's that feeling we get, especially when it comes to negative emotions. So you know, when someone says something that sets you off, Shimpa is your trigger. That's a good way to say it. It's that bodily sensation that just something pisses you off, and you're just like, and you feel the volcano, and the hairs on the back of your neck stand up. You guys know what I'm talking about. It's a difficult concept to describe, but you guys we've all felt this before. And so in Buddhism, like I said, they call it Shimpa. That's our hook, our trigger. That's that thing that hooks us and takes us down, you know, the path of the dark side there. And, you know, the dark side may have milk and cookies, guys, but they're way better on the other side. They taste way better, right? Not on the dark side, though. And so when it comes to that, it's about realizing, you know, what is that thing that's hooking you? What's going to set you off? And in life, we always come into conflict with something that has a way of hooking us. And once again, you know, we can only change the way that we respond and relate to that Shimpa. And so what is recommended is that, you know, we need to recognize it. We need to learn to relax with it. We need to learn to refrain. And then we just need to learn kind of how to resolve that trigger. And once again, you know, life is a learning and growing process. And even if you figure out what triggers, you know, what triggers you, it doesn't mean that we're perfect and we're always going to be like, haha, I have that trigger. I'm not going to react on it. I'm going to be cool and calm this time. No, fail. We always end up, you know, cracking at least once in a while, right? And once again, that's okay too. You know, that's part of being human. You know, the point of recognizing and learning to figure out what those hooks are in life is that once you figure out, you learn how to change that reaction so that you can have those more positive and productive reactions that serve you. Because in the long run, stress, anger, negativity, all they do is waste our own energy and make us feel bad. And you know, that's really the last thing that we want to do in life. And like I said, we're not always going to get it right in life, but that's okay. You know, we just got to keep working at it and keep trying to set that positive example and just keep doing the best we can along our path of self-actualization and in helping, you know, encourage and support each other. So those are some of the ways that stress affects us, some of those coping mechanisms. And then lastly, this is just what I was talking about. I have this progressive muscle relaxation for you. And so basically it's just about, you know, breathing in and out of those muscles, allowing them to untense. And then, you know, a lot of times these types of exercises can help you if you have trouble falling asleep, because, you know, stress tends to keep us up at night, tends to keep that monkey mind of ours going. That's kind of what the Buddhists call it. They say we have this monkey mind because we're constantly chattering at ourselves, right? And stress can really make us chatter at ourselves. And, you know, like we said, we know it has those physical properties to it. And so things like sleep, it can inhibit our sleep too. And then what, you know, that's kind of a chain reaction that can cause other adverse things in our life there. So if you never tried a progressive muscle relaxation, I do recommend you try them because they are They are really helpful, and here's just a really short one that I will teach you guys. So for a lot of us, we tend to hold stress in kind of our back and our shoulders, and then because we're bipedal creatures, and you know, we hold a lot of stress in our hips and kind of in our stomach area. So that's a common sign of stress, right? Maybe have some kind of stomach discomfort, indigestion type problem there. So basically, a good way is just simply breathing in and out from deep within your belly, getting rid of all that negative air in there. And that's a good way to help relieve the stress in that lower part of the body. Now, when it comes to the our heads, because you know headaches are a common a physical ailment that most people, a common ailment that people experience from stress. And so when we start to feel those stress headaches, those cluster headaches, migraine, whatever you want to call it, our heads start to hurt, a good way to help relax those muscles is smiling. And there's actually a particular way to do it. You guys are going to laugh at me, but this is the way you do it. You have to open your eyes as big as you can and smile as wide as you can. Hold it for a few minutes and then relax your whole face. And you will feel a difference in the blood flow. So it's kind of like... And then you just breathe it all out. But you guys see, I mean, it's like pretty much, you know, kind of maybe a deer in headlights type face, because you pretty much are like, you know, really scrunching your face up, but you know, you're not doing it in that scowling type way. You're doing it in that more smiling and uplifting way, because what does that do? That goes back and shows us that mind, body, and kind of emotion connection. Even though you look goofy and may feel goofy doing it, just the fact that you know that you're smiling, that already puts you in a more positive mood. So, all right, guys, that ends our lecture on stress. Thanks. Bye.